Have you noticed that your buttocks, thighs, or calves start to ache, cramp, or go numb when you walk or stand, and then the pain fades the moment you sit down or lean forward? That walk, rest, walk pattern is a classic clue to a condition called lumbar spinal stenosis. Today I'll walk you through what stenosis actually is and why your legs go numb, who tends to get it along with a quick self-check, how it differs from a herniated disc and from circulation problems in your legs, what truly helps at home and what treatment involves, and finally the red flag symptoms that mean you should be seen right away. One important note before we start. This is general health information. So what is lumbar spinal stenosis? Running down the middle of your spine is a bony tunnel that your spinal cord and nerves travel through, called the spinal canal. Stenosis simply means that canal in your lower back has narrowed, crowding the nerves that pass through it. Why does it narrow? In most people it's age-related wear and tear, usually several changes happening at once. The disc between two vertebrae flattens and loses height. The small facet joints at the back of the spine enlarge and grow bone spurs, and a ligament lining the back of the canal thickens. Together they crowd the space the nerves need, most often at the L4 to Now let's do a quick self-check. And remember, this is only a guide, not a confirmation. The most telling feature of stenosis is that your symptoms change with your posture. Ask yourself a few things. When you walk, do your buttocks, thighs, or calves ache or go numb until you have to stop and rest? Does sitting down or bending forward at the waist make the pain ease? Does standing up straight or arching your back make it worse? And can you go noticeably farther when you push a shopping cart or ride a bike? That relief when you lean forward is the single most useful clue. In clinics we even When a leg goes numb, most people's first thought is it a disc? Stenosis and a herniated disc can often be told apart by how they respond to posture. With stenosis, sitting or bending forward usually feels better because it opens the canal, while standing and walking make it worse. A herniated disc can be the opposite, feeling worse when you bend forward, and it often starts suddenly after a movement. There's another look-alike too, narrowed arteries reducing blood flow to your legs, called vascular claudication. Here's a simple one-liner to keep in mind. If sitting or leaning forward quickly relieves it, think spine and nerve. If only So what actually helps? The guiding principle is simple. A slightly forward bent posture opens the canal and feels better, and you can build that into your day. With walking, don't stop, just break it up. Sit and rest before the leg pain forces you to lean forward on a cart, walker, or cane, and favor flat or indoor routes. A stationary bike is often well tolerated. Gentle forward bending stretches tend to feel good too, like single and double knee to chest, pelvic tilts, and a gentle cat or child's pose. But be careful with repeated back bending moves like standing back bends or cobra poses, because arching backward narrows the canal. If treatment is needed, it almost always starts conservative. Before we wrap up, the most important part, the red flags. Most stenosis is slow and manageable, but some symptoms can be emergencies, and you should not wait. Get emergency care now if you have new bladder or bowel problems like being unable to urinate or losing control, saddle numbness meaning loss of feeling in the groin or inner thigh area, rapidly worsening leg weakness or a new foot drop, or severe nerve symptoms right after a fall. These can signal cauda equina syndrome, where the sooner it's treated, the better. So to sum up, leg pain that eases when you sit or lean forward may be stenosis. Forward bending posture and broken up